Are you or someone you love about to have surgery soon? Before you step into that hospital, watch this video to the end, because understanding what really happens in those last 10 minutes can make the fear smaller and your decisions safer. Number 10, waiting alone. In this first phase, the silence is heavy. The clock seems to stop, and every worst-case scenario your mind can invent suddenly feels possible. You hear distant footsteps and muffled voices, but no one is at your bedside, and it can feel like you have been abandoned at the exact moment you need help the most. In reality, this brief isolation is not neglect. It is logistics and safety. Staff are confirming test results, blood work, imaging, and operating room readiness, so that once you move, everything you need is in place and nothing critical has been missed. This interval lets the team coordinate anesthesia, surgery, and recovery, so the whole process runs smoothly and safely for you. Hospitals that structure this phase will see lower anxiety and better patient experience. Number 9, the final questions. Right when you are most afraid, someone leans over you and starts asking the same questions again. Name, date of birth, which body part, which side. It can feel like nobody is sure what they are doing, like the people about to operate on you are double-checking because they might make a catastrophic mistake. But this repetition is not a sign of confusion. It is a safety barrier built precisely so that catastrophic mistakes do not happen. Modern surgical systems deliberately force multiple identity and procedure checks because repeating simple facts has been shown to prevent wrong patient and wrong site surgery. Nurses, anesthesiologists, and surgeons all independently verify your identity and procedure as part of standardized safety checklists. That strange feeling of, "Why are they asking me again?" is exactly the feeling of a system designed to protect you, not to doubt you. Number 8, when personal items are taken. The moment your jewelry, watch, glasses, or dentures are removed, many people feel suddenly exposed and helpless, as if pieces of their identity and independence are being stripped away. Without these familiar objects, the hospital bed can feel more like a stretcher, and you more like a passive object than a person. Yet this step exists because small objects can cause surprisingly serious medical problems. Metal jewelry can heat up with surgical equipment, harbor bacteria, or interfere with monitors, and loose items can fall, break, or obstruct airways during anesthesia. Removing metal, plastics, and electronics helps reduce infection risk, burns, and equipment malfunction in the operating room. Even though it feels like a loss of control, it is actually a controlled way to shield your body and your belongings from harm. Number 7, when the bed starts moving. As soon as your bed begins to roll, the fear often spikes. You are no longer thinking about surgery. You are physically being taken to it, with no easy way to step off or turn around. The ceiling lights slide past in fragments, and it can feel like being pushed towards something irreversible. In clinical reality, this movement marks the transition into a more tightly monitored, highly controlled environment. Transport teams are trained to watch your breathing, circulation, and comfort, while bringing you closer to the equipment and specialists who can help you the most. The corridor and operating area are intentionally organized so that emergency tools and staff are only seconds away during transport. The sense of being carried toward the unknown is, medically, you being escorted into the safest possible space for the procedure. Number 6, the cold, quiet hallway. The hallway often feels colder, emptier, and more echoing than the ward, which can make it seem like you are entering a more dangerous alien world. Each change in sound or temperature can amplify the thought that you are crossing a point of no return. But this stretch of corridor is really just the bridge into a more controlled area of the hospital. As you pass through it, you are moving away from busy public spaces and toward rooms where access, airflow, and equipment are more tightly managed for surgery and anesthesia. Number 5, first sight of the operating room. When the doors open and you see bright lights, metal instruments, and machines, The room can look more like a scene from a disaster movie than a place of healing. Those same visual elements are, in fact, tools that make surgery safer and more precise. Intense overhead lighting reduces shadows and helps surgeons see tiny structures, while the apparently intimidating machines are there to support your breathing, circulation, and temperature with high precision. The empty floor space and organized layout are designed so staff can move quickly and keep sterile areas uncontaminated. The cold metal room is actually a meticulously controlled environment built around your physiology, not your fear. Number 4, strangers speaking calmly around you. Lying on the table, you hear people using medical jargon, discussing your body, your case, your numbers, often without addressing you directly. It can sound like a detached conversation about a problem rather than about a human being who is scared and awake right in front of them. Yet the calm, almost routine tone is part of how teams maintain focus and coordination. Each person has a defined role, and their structured communication reduces errors under pressure, allowing them to respond quickly if anything unexpected happens. Standardized briefings and checklists draw attention to allergies, special risks, and critical steps, so your unique situation is clearly understood by everyone. The fact that they sound calm does not mean they do not care. It means they are using rehearsed, stable patterns of speech that keep you medically safe. Number 3, being shifted to another bed. When several staff members suddenly appear at your sides and count aloud to slide you from your bed onto the operating table, it can feel shockingly fast and impersonal. For a moment, you may feel like a body being handled rather than a person being cared for. The speed and coordination, however, are precisely what protect you. A synchronized transfer reduces the strain on your spine and joints, prevents falls, and avoids pulling on IV lines or catheters, all while minimizing the time you spend in an awkward or exposed position. Multiple people support different parts of your body to avoid twisting, dropping, or compressing vulnerable areas. Straps, cushions, and positioning devices are applied not to restrain you emotionally, but to prevent pressure injuries and accidental movement once anesthesia removes voluntary control. Number 2, when the monitors take over. As cuffs tighten around your arm, clips pinch your finger, and sticky pads are placed on your chest, it can feel like you're being turned into a collection of numbers on a screen. The constant beeping can sound like a countdown to something dangerous rather than a guardian against it. In fact, these monitors are your early warning system. They measure your heart rhythm, blood pressure, oxygen level, and often temperature continuously, giving the anesthesia team real-time information, so they can correct even tiny changes before they become problems. Basic monitoring, blood pressure, pulse oximetry, and electrocardiography is an international standard for all modern anesthesia. Those beeps that make you nervous are the sounds that let the team keep you physiologically stable from moment to moment. Number 1, the last fully conscious moment. Knowing that you are about to go under can be one of the most intense fears. The thought that you will lose control, lose awareness, and trust your life to meds and strangers you barely know. Some people worry they will feel themselves fading away or never wake up. Medically, this moment is carefully controlled and highly reversible. The anesthetic meds are dosed based on your body, your health, and the planned procedure, while the same monitors and specialists stay by your side to keep your breathing, circulation, and brain perfusion within safe ranges. Many patients describe only a brief warmth in the arm or a few seconds of lightheadedness before a smooth, rapid loss of consciousness. For the team, this is not a leap into the unknown, but the beginning of a monitored, adjustable state in which your body is continuously protected until you wake in recovery.